1. A nurse is assigned to care for 4 clients. Which client should the nurse assess first? A. A client with pneumonia reporting chest pain. B. A client scheduled for discharge in 1 hour. C. A client with a urinary catheter complaining of mild discomfort. D. A client waiting for lab results. Answer: A. A client with pneumonia reporting chest pain. Rationale: chest pain in a client with pneumonia may indicate a life-threatening complication, such as a pulmonary embolism or cardiac involvement, requiring immediate assessment using the ABC airway, breathing, circulation, priority framework. The other client's conditions are stable or routine and can be addressed after the priority client. 2. A nurse is delegating tasks to an unlicensed assistive personnel UAP. Which task is appropriate to delegate? A. Administering oral medications. B. Assessing a client's respiratory status. C. Assisting a client with ambulation. D. Developing a care plan for a new admission. Answer: C. Assisting a client with ambulation. Rationale: assisting with ambulation falls within the UAP scope of practice, as it involves basic supportive care under RN supervision. Administering medications, assessing, and developing care plans require RN judgment and are outside the UAP's legal scope, ensuring patient safety and accountability. 3. A nurse observes a staff member not washing hands before client contact. What is the nurse's priority action? A. Report the incident to the charged nurse immediately. B. Provide immediate education to the staff member. C. Document the observation in the staff member's file. D. Ignore the incident if no harm is apparent. Answer: B. Provide immediate education to the staff member. Rationale: immediate education promotes infection control and patient safety by correcting the behavior at the moment, aligning with evidence-based practice. Reporting or documenting can follow if the issue persists, but direct intervention is the priority to prevent harm. Ignoring it violates safety standards. 4. A nurse is prioritizing care for a client with a fall risk. Which intervention has the highest priority? A. Applying a bed alarm. B. Educating the client on fall prevention. C. Administering pain medication. D. Completing a full physical assessment. Answer: A. Applying a bed alarm. Rationale: applying a bed alarm is the highest priority for a fall risk client, as it provides immediate protection by alerting staff to movement, reducing injury risk per safety guidelines. Education and assessment are important, but secondary to this preventive measure. 5. A nurse is deciding whether to delegate wound dressing changes to a licensed practical nurse (LPN). Which factor supports this decision? A. The wound is a stage 4 pressure ulcer with signs of infection. B. The LPN has no prior training in wound care. C. The wound is a stable, healing surgical incision. D. The client requires a sterile procedure without supervision. Answer: C. The wound is a stable, healing surgical incision. Rationale: delegating a stable, healing surgical incision to an LPN is appropriate within their scope, provided they are trained, and it ensures efficient care delivery. Complex wounds with infection or requiring sterile technique without supervision exceed LPN capabilities, necessitating RN oversight. 6. A nurse receives a handoff report on 4 clients. Which client should the nurse see first? A. A client with diabetes awaiting insulin administration. B. A client with a fever of 101 degrees Fahrenheit post-surgery. C. A client with chronic back pain requesting medication. D. A client with shortness of breath and a respiratory rate of 28. Answer: D. A client with shortness of breath and a respiratory rate of 28. Rationale: shortness of breath with a respiratory rate of 28 indicates a potential respiratory emergency, e.g., hypoxia, requiring immediate assessment per the ABC priority framework. The other client's conditions are manageable or non-urgent. 7. A nurse is reviewing medication administration safety. Which action best reduces medication errors? A. Administering medications without double-checking the order. B. Using the 5 rights of medication administration. C. relying solely on barcode scanning without verification. D. Giving medications based on client requests alone. Answer B. Using the 5 rights of medication administration. Rationale: the 5 rights, right patient, drug, dose, route, time, provide a structured approach to prevent medication errors, enhancing patient safety. Other options bypass critical verification steps, increasing error risk. 8. A nurse delegates vital sign monitoring to a UAP. Which instruction is most important? A. Report all vital signs regardless of values. B. Report any abnormal vital signs immediately. C. Record vital signs without notifying the nurse. D. Take vital signs only when the nurse is present. Answer B. Report any abnormal vital signs immediately. Rationale: instructing the UAP to report abnormal vital signs ensures timely intervention for deteriorating conditions, aligning with delegation accountability. Recording without reporting or limiting timing delays care and compromises safety. 9. A nurse is caring for a client with a high fall risk. Which ethical consideration is most relevant? A. Ensuring the client's autonomy to ambulate unassisted. B. Balancing safety with the client's dignity and independence. C. Prioritizing cost-saving measures over safety interventions. D. Allowing family to make all care decisions. Answer B. Balancing safety with the client's dignity and independence. Rationale: ethical nursing practice involves balancing safety, e.g., fall prevention, with respecting the client's dignity and autonomy, promoting holistic care. Ignoring safety or over-relying on family decisions violates professional standards. 10. A nurse is prioritizing care during a code situation. Which action takes precedence? A. Documenting the code event. B. Ensuring the crash cart is stocked. C. Starting chest compressions if needed. D. Assigning roles to team members. Answer C. Starting chest compressions if needed. Rationale: starting chest compressions addresses the immediate life-threatening need circulation per the ABC priority framework during a code. Documentation, stocking, and role assignment are secondary to life-saving actions. 11. A nurse is delegating tasks to an LPN and a UAP. Which task should the nurse retain? A. Administering 4 antibiotics. B. Measuring intake and output. C. Providing a bed bath. D. Taking vital signs. Answer A. Administering 4 antibiotics. Rationale: administering 4 antibiotics requires RN assessment and judgment, falling outside the LPN and UAP scopes. Intake/output, bed baths, and vital signs can be delegated with proper supervision, ensuring efficient care delivery. 12. A nurse notices a client's bed alarm is silenced. What is the nurse's first action? A. Assess the client for immediate fall risk. B. Notify the maintenance team to fix the alarm. C. Document the incident in the client's chart. D. Reassign the client to another nurse. Answer A. Assess the client for immediate fall risk. Rationale: assessing the client first addresses the immediate safety concern, as a silenced alarm increases fall risk. Notification, documentation, or reassignment can follow but are secondary to this priority action. 13. A nurse is prioritizing care for a client with a new onset of confusion. Which action is most appropriate? A. Perform a neurological assessment. B. Administer PRN anti-anxiety medication. C. Delegate a full physical exam to the UAP. D. Wait for the next shift to evaluate the client. Answer A. Perform a neurological assessment. Rationale: new onset confusion may indicate a neurological emergency, e.g. stroke, requiring an RN assessment to prioritize care. Medication, delegation to a UAP, or delaying evaluation risks missing critical findings. 14. A nurse is teaching a UAP about infection control. Which statement indicates understanding? A. I should wear gloves only if the client has an infection. B. Hand hygiene is required before and after client contact. C. I can reuse gloves for multiple clients if cleaned. D. Masks are optional during wound care. Answer B. Hand hygiene is required before and after client contact. Rationale: hand hygiene before and after client contact is a cornerstone of infection control per CDC guidelines, reducing transmission risk. Other statements reflect misconceptions that compromise patient safety. 15. A nurse is making client assignments. Which client should the nurse assign to the LPN? A. A client with a chest tube requiring suction adjustment. B. A client with a new diagnosis of heart failure needing teaching. C. A client with a stable postoperative incision needing dressing changes. D. A client with unstable vital signs post-surgery. Answer: C. A client with a stable postoperative incision needing dressing changes. Rationale: dressing changes for a stable incision fall within the LPN scope with proper training, allowing efficient delegation. Chest tube adjustments, teaching, and unstable vitals require RN judgment and assessment. 16. A nurse identifies a medication error after administration. What is the first step? A. Notify the physician immediately. B. Complete an incident report. C. Assess the client for adverse effects. D. Inform the client's family. Answer: C. Assess the client for adverse effects. Rationale: assessing the client ensures immediate safety by identifying and managing potential harm from the error. Notification, reporting, and family communication follow, but are secondary to this priority action. 17. A nurse is prioritizing care for a client with a blood transfusion reaction. Which action is most urgent? A. Stop the transfusion. B. Administer antihistamines. C. Notify the blood bank. D. Document the reaction. Answer: A. Stop the transfusion. Rationale: stopping the transfusion is the first step in a reaction, e.g., hemolytic or allergic, to prevent further harm, per safety protocols. Subsequent actions like medication, notification, and documentation follow this priority. 18. A nurse delegates feeding a client to a UAP. Which instruction is critical? A. Feed the client slowly to prevent choking. B. Use any available spoon from the unit kitchen. C. Leave the client unattended during feeding. D. Ignore dietary restrictions. Answer: A. Feed the client slowly to prevent choking. Rationale: feeding slowly prevents choking, a safety priority within the UAP's delegated task. Using unsterilized utensils, leaving unattended, or ignoring restrictions increases risk and violates care standards. 19. A nurse is deciding whether to delegate a task to an LPN. Which legal consideration is most important? A. The LPN's willingness to perform the task. B. The LPN's Training and State Practice Act. C. The nurse's personal comfort with delegation. D. The client's preference for care providers. Answer: B. The LPN's Training and State Practice Act. Rationale: legal delegation requires ensuring the LPN is trained and the task aligns with the state's Nurse Practice Act, ensuring accountability and safety. Other factors are secondary to legal compliance. 20. A nurse is managing a busy unit with multiple alarms sounding. Which action addresses alarm fatigue? A. Silence all alarms to reduce noise. B. Assess each alarm's priority before responding. C. Delegate alarm monitoring to the UAP. D. Turn off non-critical alarms permanently. Answer: B. Assess each alarm's priority before responding. Rationale: assessing alarm priority reduces alarm fatigue by focusing on critical needs per safety guidelines. Silencing, delegating to UAP, or turning off alarms increases risk and violates safety protocols. 21. A nurse is prioritizing care for a client with a stage 3 pressure ulcer. Which intervention is most important? A. Repositioning every 2 hours. B. Applying a topical antibiotic. C. Ordering a nutritional consult. D. Documenting the wound size. Answer: A. Repositioning every 2 hours. Rationale: repositioning every 2 hours is the highest priority to relieve pressure and prevent further tissue damage, per evidence-based safety protocols. Other interventions support healing but are secondary. 22. A nurse is delegating tasks to a UAP during a shift change. Which task is inappropriate? A. Emptying a urinary drainage bag. B. Measuring a client's blood pressure. C. Inserting a nasogastric tube. D. Assisting with oral hygiene. Answer: C. Inserting a nasogastric tube. Rationale: inserting a nasogastric tube requires RN assessment and skill exceeding the UAP scope. Other tasks, emptying drainage, measuring BP, oral hygiene, are within UAP capabilities with supervision. 23. A nurse notices a client's foresight is red and swollen. What is the nurse's priority action? A. Apply a warm compress to the site. B. Stop the infusion and assess the client. C. Administer an analgesic for discomfort. D. Notify the physician for new orders. Answer: B. Stop the infusion and assess the client. Rationale: stopping the infusion and assessing for phlebitis or infiltration addresses the immediate safety concern, preventing further harm. Warm compresses, analgesics, or physician notification follow this priority action. 24. A nurse is teaching a client about fall prevention. Which statement indicates understanding? A. I should wear socks without non-slip soles. B. I will use my call light if I need to get up. C. I can get out of bed without assistance. D. I don't need rails since I feel steady. Answer: B. I will use my call light if I need to get up. Rationale: using the call light ensures assistance, reducing fall risk per safety protocols. Other statements: socks without grips, no assistance, no rails, increase fall risk and indicate a lack of understanding. 25. A nurse is assigning clients to an LPN. Which client is most appropriate? A. A client with a new onset of chest pain. B. A client with a stable colostomy needing irrigation. C. A client requiring discharge teaching. D. A client with a suspected stroke. Answer: B. A client with a stable colostomy needing irrigation. Rationale: irrigating a stable colostomy is within the LPN scope with training, allowing efficient delegation. Chest pain, discharge teaching, and stroke assessment require RN judgment and assessment skills. 26. A nurse is reviewing a client's medication list for safety. Which finding requires immediate action? A. A client on warfarin with an INR of 1.0. B. A client on lisinopril with a blood pressure of 130 over 80 mmHg. C. A client on metformin with a glucose of 120 mg per deciliter. D. A client on furosemide with a potassium of 3.8 milliequivalent/L. Answer: A. A client on warfarin with an INR of 1.0. Rationale: an INR of 1.0 in a client on warfarin indicates subtherapeutic anticoagulation, increasing clotting risk, e.g. stroke, requiring immediate dose adjustment. Other values are within normal limits. 27. A nurse is delegating to a UAP during a busy shift. Which task is safe to delegate? A. Evaluating a client's pain level. B. Turning a client every 2 hours. C. Inserting a Foley catheter. D. Administering a PRN medication. Answer: B. Turning a client every 2 hours. Rationale: turning a client is a supportive task within the UAP scope, promoting pressure ulcer prevention. Pain evaluation, catheter insertion, and medication administration require RN assessment and are not delegable. 28. A nurse is prioritizing care for a client with a suspected infection. Which action is most urgent? A. Obtain a wound culture. B. Administer prescribed antibiotics. C. Monitor vital signs every 4 hours. D. Educate the client on infection signs. Answer: B. Administer prescribed antibiotics. Rationale: administering antibiotics addresses the immediate need to treat the suspected infection, potentially preventing sepsis, per prioritization guidelines. Other actions support but follow this priority. 29. A nurse is considering ethical implications of delegating a task. Which factor is most relevant? A. The task's completion time. B. The client's satisfaction with the delegate, C. The delegate's competence and scope, D. The nurse's workload reduction. Answer, C. The delegate's competence and scope. Rationale. Ensuring the delegate's competence and adherence to their legal scope protects patient safety and upholds ethical accountability. Other factors are secondary to this primary consideration. 30. A nurse is managing a unit with frequent monitor alarms. Which strategy best addresses alarm fatigue? A. Increase alarm volume to ensure awareness. B. Customize alarm parameters to client needs. C. Silence alarms during shift changes. D. Assign alarm monitoring to one staff member. Answer, B. Customize alarm parameters to client needs. Rationale. Customizing alarm parameters reduces non-actionable alarms, addressing alarm fatigue per safety guidelines. Increasing volume, silencing, or single-staff monitoring increases risk and is ineffective. 31. A nurse is prioritizing care for a client with a stage 2 pressure ulcer. Which intervention is most important? A. Applying a barrier cream. B. Repositioning every 2 hours. C. Ordering a wound culture. D. Documenting the ulcer stage. Answer, B. Repositioning every 2 hours. Rationale. Repositioning every 2 hours is the highest priority to relieve pressure and prevent worsening, per evidence-based safety protocols. Other interventions support healing but are secondary. 32. A nurse delegates a task to an LPN but fails to provide supervision. What is the legal implication? A. The LPN assumes full responsibility. B. The nurse remains accountable for outcomes. C. The facility is solely liable. D. The client waives liability. Answer, B. The nurse remains accountable for outcomes. Rationale. The delegating RN retains accountability for outcomes, per the Nurse Practice Act, even if supervision is lacking. This ensures patient safety and legal responsibility are maintained. 33. A nurse notices a client's oxygen saturation is 88%. What is the nurse's priority action? A. Increase the oxygen flow rate. B. Notify the physician. C. Document the reading. D. Reassess after 30 minutes. Answer, A. Increase the oxygen flow rate. Rationale. An oxygen saturation of 88% indicates hypoxia, requiring immediate intervention to improve oxygenation per the ABC priority framework. Notification, documentation, and reassessment follow this action. 34. A nurse is teaching a UAP about safe client handling. Which statement indicates understanding? A. I should lift clients without assistance if they're light. B. I will use a mechanical lift for immobile clients. C. I can move clients by pulling their arms. D. Gloves are not needed for transfers. Answer, B. I will use a mechanical lift for immobile clients. Rationale. Using a mechanical lift prevents injury to both client and staff, aligning with safety protocols. Other statements increase fall or injury risk and indicate a lack of understanding. 35. A nurse is assigning clients to an RN and an LPN. Which client should the RN take? A. A client with a stable 4 infusion. B. A client with a new onset of seizures. C. A client needing a routine dressing change. D. A client with a scheduled physical therapy session. Answer, B. A client with a new onset of seizures. Rationale. A new onset of seizures requires RN assessment and intervention, e.g. airway management, exceeding LPN scope. Stable IVs, dressing changes, and therapy can be managed by an LPN or delegated. 36. A nurse identifies a near-miss medication error. What is the first step? A. Inform the client of the error. B. Complete an incident report. C. Analyze the cause with the team. D. Notify the risk management department. Answer, C. Analyze the cause with the team. Rationale. Analyzing the cause with the team prevents recurrence, aligning with safety improvement protocols. Reporting, notification, and client communication follow, but are secondary to this proactive step. 37. A nurse is prioritizing care for a client with a transfusion reaction. Which action is most urgent after stopping the transfusion? A. Administer 4 fluids. B. Send the blood bag to the lab. C. Take the client's vital signs. D. Notify the physician. Answer: C. Take the client's vital signs. Rationale: taking vital signs assesses the client's immediate condition, e.g., hypotension, fever, post-transfusion reaction, guiding further intervention. Other actions support but follow this priority assessment. 38. A nurse delegates a task to a UAP but forgets to provide clear instructions. What is the outcome? A. The UAP is fully liable for errors. B. The nurse shares liability with the UAPC. The nurse retains full accountability. D. The facility assumes all responsibility. Answer: C. The nurse retains full accountability. Rationale: the delegating nurse retains full accountability for ensuring clear instructions per the Nurse Practice Act to protect patient safety. This underscores the RN's responsibility in delegation. 39. A nurse is prioritizing care during a mass casualty event. Which client should be treated first? A. A client with a fractured arm. B. A client with a tension pneumothorax. C. A client with a minor laceration. D. A client with a stable pelvic fracture. Answer: B. A client with a tension pneumothorax. Rationale: a tension pneumothorax is a life-threatening emergency, compromised breathing, requiring immediate decompression per the ABC priority framework. Other injuries are less urgent and can wait. 40. A nurse is teaching a client about medication safety. Which statement indicates understanding? A. I should take all my medications at once to save time. B. I will keep my medications in their original containers. C. I can share my medications with family if needed. D. I don't need to tell my doctor about over-the-counter drugs. Answer: B. I will keep my medications in their original containers. Rationale: keeping medications in original containers prevents mix-ups and ensures proper identification, enhancing safety. Other statements increase error risk and indicate a lack of understanding.